I'm Dr. Moira Gunn. I'm the host of Biotech Nation on NPR. It's a regular segment of Tech Nation. You can hear it at npr.org on their 24-hour program stream. You can hear it 4 times a weekend if you're interested. Biotech interviews every week. I'm speaking with Sanj Singh. He is the president and CEO of AdeTherapeutics. That's ADE, AdeTherapeutics, and that's in Saskatoon, Canada.
Yeah, the biomedical hub of Canada, yes.
There you go, sunny biomedical hub of Canada.
It is.
There
There's
you
a lot of
have
sun
it.
there.
Exactly.
Moira. Thanks for having me.
You have a really interesting therapy going on. So many people have been told that they have fibroids or they have an operation and all of a sudden everything is thick and it's sticking to me, terrible things. And it happens all over our body.
It does. In fact, Moira, if I asked you how many people do you know that have had surgeries, what would you say?
Well, the ones they'll cop to.
Yeah.
Everybody.
Everybody. So, you know, there's a common problem in worldwide. There's 235 million surgeries done. In the U.S. alone, there's anywhere, depending on inpatient, outpatient, about 80 million surgeries done. And all of these are really insult to the body, which creates these, as you say, fibroids or scar tissue. The scar tissue in itself is not the problem. It's what it causes, and it's the complications. So small bowel obstruction, infertility for women, chronic pain. And this means repeat visits back into the hospital, which is costly for them, for the hospital system, but also it means for the patients and their caregivers, it's very inconvenient. You lose productivity, your quality of life decreases, and also a lot of surgeons get sued because of these complications.
Yeah, they're serious, yeah.
In all around, and there's a significant unmet need. There is no standard of care right now to deal with these types of problems, not only resulting from surgery, but also other types of fibrosis like liver fibrosis or kidney fibrosis. And so we're hoping that our approach can, you know, lend a hand to that type of a solution.
So how did this approach come about?
Well, our general surgeon really is our chief scientific officer, and he was doing some work in burn and head trauma. And what he really saw in the burn and head trauma was how patients reacted to burns. You know, they went into this state of, they call it a catabolic state, where they need to repair and try to heal. That's what we're programmed to do. If we get an injury, we want to heal as fast as we can. And he took that concept and said, I think that this can be applied to my world of surgery, because surgery, like burn, is another form of insult. And the body, he saw, was reacting in similar ways as a burn does. And that's really where the concept came from. And then we started looking at how can we modulate, you know, the body to repair after surgery.
How can we heal without the fibrosis?
Yeah, so yeah, the world is, you know, the world of fibrosis is not completely understood, and that's probably why there is no standard of care. You know, in our evolutionary biology, one of our ophthalmologists said, you know, once you start the water down the mountain and you try to stop it here, it's going to find another pathway. And that's really where fibrosis is. What we're trying to do is prevent the water from even coming down the mountain by making sure that the body heals and regenerates right at the time of insult. So
before you close up?
Before you close up, it's administered at the time of surgery, and it really helps the body to recover in that critical first 3 days before all of that process starts.
So where are you in this process?
Right now we're in phase 2 trials. We're doing this in Europe in myomectomies, which if you're a gynecologist, you know what that is, but for most people it's just these...
As the females, they're taking fibroids out.
Yeah, exactly, out of uterus. And that trial is going underway right now, and we're looking to now move this technology also into spinal surgeries and also into ophthalmology as well, where fibrosis is a problem.
Now, I want to ask you, when we look at these kinds of things, is it difficult to get people to invest in something that happens during surgery? Is that a sort of a different kind of a concept?
I don't think it'd be, I think the investing is, there's lots of money for fibrosis, let's put it that way.
So anything in the fibrosis area.
However, it's really who's your team. And one of the things we've been lucky is that we've shared our biology and our science with some of the top people in the field, and they have been attracted to it. So for example, we recently announced this past week at Bio, Dr. James Greenberg from Brigham and Women's Health, a Harvard professor who gynecologists who joined our team. Our ophthalmology is being done by one of the top guys, Dr. Ike Ahmed and Mark Sherwood. So we've built this team of phenomenal world-class physicians to give it credibility to the science to help maybe make a difference in this world.
It's not who you know, it's who you know knows.
Yes, that's a good way to put it.
That's great. Hey Sanj, thank you so much.
Thank you, Maura.
That's terrific.
Yes.
My guest today is Sanj Singh. He's the president and CEO of AdeTherapeutics in Saskatoon, Canada. I'm Dr. Moira Gunn, host of Biotech Nation on NPR. Thanks for joining us. We're here at the Bio 2013 Buzz Center.